Primary care is overwhelmed, and most primary care practices are still operating in reactive mode. Chronic disease is rising, physicians are burnt out, and value based payment models are demanding more proactive population management. I'm Natasha Jackson, a registered nurse and care management consultant. Today, I'm going to break down why nurse led care management is not optional anymore. It is the future infrastructure of primary care, not more physician visits, but structured nurse led care management. Let's talk about the reality of chronic disease. 6 in 10 adults in the United States live with at least one chronic condition. 4 in 10 have two or more. We are managing diabetes, hypertension, heart disease, COPD, chronic kidney disease, and a lot of other chronic health conditions. These patients are not just taking one medication. Sometimes they're taking 5, 7, or even 10 medications. They're seeing multiple specialists who are not communicating with each other. Care is fragmented and there's little to no follow up. So, what happens? Missed follow up appointments, medication confusion, uncontrolled A1Cs, preventable ER visits, and avoidable hospitalizations. A 15-minute primary care visit cannot manage longitudinal chronic disease. That is not a criticism of physicians, it's a systems issue. Chronic disease management requires continuous oversight. Primary care, as traditionally structured, was never built for that level of ongoing management. CMS did not create chronic care management randomly. They created CCM in 2015 because unmanaged chronic disease drives cost and preventable decline. Chronic care management, remote patient monitoring, behavioral health integration. These programs exist to support care between visits. They are infrastructure models. They acknowledge something critical. Patients don't deteriorate in the exam room. They deteriorate at home without support. And if no one is monitoring medication adherence, symptom progression, blood pressure trends, or glucose readings between visits, we are always reacting after the damage is done. Care management fills that gap. It formalizes ongoing oversight, creates accountability, creates documentation, and creates the reimbursement for work that was previously invisible and not paid for. That's the infrastructure care management services provide. Care management is the nursing process operationalized at scale. Assessment, care planning, education, monitoring, follow up, reassessment. That is nursing. We are trained to see patterns, connect the dots, recognize early deterioration, educate patients in real language, advocate, and coordinate. This is not a new role for nurses. It is a formalized, reimbursable version of what we have always done. Nurses are the clinical bridge between physician decision making and patient behavior. We can translate care plans into real world execution. We translate the physician's treatment plan into an actionable plan of care to help support patients between visits. And in value based models, execution is everything. Primary care practices that integrate nurse led care management will improve quality metrics, reduce preventable hospital admissions, increase patient retention, improve medication adherence, strengthen patient engagement, and generate sustainable revenue under value based payment models. This is alignment with where CMS is going. Value based care rewards outcomes. Outcomes require monitoring. Monitoring requires infrastructure, and infrastructure requires nurses. The practice that understands this shift will thrive. The ones that don't will continue struggling under reactive, volume based pressure. The nurses who understand this shift have the opportunity to lead, consult, build businesses, and become the infrastructure primary care desperately needs. Nurse-led care management is not an add-on. It is not a side program. It is the future infrastructure of primary care. And the question is not whether this shift is happening. The question is whether you are positioning yourself to lead it. If you're a nurse who wants to understand how to build or implement nurse-led care management models, make sure you subscribe. I teach nurses how to step into this space strategically and confidently. I'll see you in the next video.